NHA Medical Assistant Anatomy and Physiology. Question 1. Which of the following instruments should a medical assistant have ready for a provider who needs to evaluate a patient's deep tendon reflexes during a neurological exam? Option A, tuning fork. Option B, percussion hammer. Option C, goniometer. Option D, otoscope. The correct answer is option B. Percussion hammer. A percussion hammer is used to test deep tendon reflexes during a neurological examination. A tuning fork evaluates vibration sense or hearing. Question 2. A patient is scheduled for a guaiac fecal occult blood test, FOBT. Which of the following dietary restrictions should the medical assistant instruct the patient to follow for 3 days prior to the test? Option A, avoid consuming red meat. Option B, avoid drinking water. Option C, consume high amounts of dairy products. Option D, avoid eating fiber-rich foods. The correct answer is option A. Avoid consuming red meat. Red meat should be avoided before a guaiac fecal occult blood test because it can cause false positive results. Water and fiber are generally not restricted unless the provider gives different instructions. Question 3. Which of the following forms must be signed by a patient to authorize an insurance company to pay benefits directly to the medical provider? Option A, encounter form. Option B, assignment of benefits. Option C, advance beneficiary notice, ABN. Option D, CMS 1500 claim form. The correct answer is option B. Assignment of benefits. An assignment of benefits authorizes the insurer to pay the provider directly. A CMS 1500 is the claim form used to bill outpatient professional services. Question 4. Which of the following plane divisions cuts the human body horizontally into superior and inferior portions? Option A, sagittal plane. Option B, frontal plane. Option C, transverse plane. Option D, coronal plane. The correct answer is option C. Transverse plane. The transverse plane divides the body into superior and inferior portions. Sagittal planes divide the body into left and right portions. Question 5. Which of the following organ systems contains the glomerulus, Bowman's capsule, ureters, and bladder? Option A, reproductive system. Option B, urinary system. Option C, digestive system. Option D, cardiovascular system. The correct answer is option B. Urinary system. The urinary system includes the kidneys, glomeruli, Bowman's capsules, ureters, and bladder. These structures filter blood, form urine, and transport or store urine. Question 6. A medical assistant is measuring a patient's apical pulse. Which of the following areas should the assistant place the stethoscope? Option A. At the 5th intercostal space, left midclavicular line. Option B. At the 2nd intercostal space, right sternal border. Option C. Over the carotid artery in the neck. Option D. In the antecubital fossa of the left arm. The correct answer is option A. At the 5th intercostal space, left midclavicular line. The apical pulse is auscultated at the 5th intercostal space at the left midclavicular line. The 2nd right intercostal space is an aortic valve auscultation area, not the apical pulse point. Question 7. Which of the following government agencies enforces standard precautions and regulations to ensure a safe and healthful working environment for healthcare employees? Option A, FDA. Option B, CDC. Option C, OSHA. Option D, DIA. The correct answer is option C. OSHA. OSHA enforces workplace safety standards, including bloodborne pathogen requirements and safe clinical practices. The CDC issues guidance but does not enforce workplace regulations the way OSHA does. Question 8. Which of the following values represents a normal respiratory rate for a healthy adult at rest? Option A 8 to 10 breaths per minute. Option B 12 to 20 breaths per minute. Option C 22 to 30 breaths per minute. Option D 32 to 40 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. A normal adult resting respiratory rate is 12 to 20 breaths per minute. Rates above this range suggest tachypnea, while rates below it suggest bradypnea. Question 9. A provider requests a medical assistant to perform a visual acuity test on a patient using a Snellen chart. How far away from the chart should the patient stand? Option A 10 feet. Option B 15 feet. Option C 20 feet. Option D 25 feet. The correct answer is option C, 20 feet. A Snellen visual acuity test is typically performed with the patient standing 20 feet from the chart. Shorter distances require specially calibrated charts or mirrored setups. Question 10. Which of the following body systems is primarily responsible for secreting hormones directly into the bloodstream to regulate processes such as metabolism and growth? Option A lymphatic system. Option B nervous system. Option C endocrine system. Option D integumentary system. The correct answer is option C, endocrine system. The endocrine system secretes hormones directly into the bloodstream to regulate metabolism, growth, reproduction, and other processes. The nervous system communicates mainly through electrical impulses and neurotransmitters. Question 11. Which of the following specialized legal terms refers to a provider withdrawing medical care from a patient without giving sufficient notice or providing a qualified replacement? Option A assault. Option B malpractice. Option C abandonment. Option D defamation. The correct answer is option C, abandonment. Abandonment occurs when a provider ends care without adequate notice or arranging appropriate replacement care. Defamation involves false statements that harm reputation. Question 12. Which of the following conditions is characterized by a decrease in the total number of red blood cells or a lower than normal amount of hemoglobin in the blood? Option A leukemia. Option B polycythemia vera. Option C anemia. Option D thrombocytopenia. The correct answer is option C, anemia. Anemia is a reduction in red blood cells or hemoglobin, decreasing oxygen carrying capacity. Thrombocytopenia is a low platelet count, not a low red blood cell or hemoglobin level. Question 13. Which of the following microsampling collection tubes contains the additive sodium heparin? Option A lavender microtainer. Option B green microtainer. Option C red microtainer. Option D gold microtainer. The correct answer is option B, green microtainer. Green microcollection tubes contain heparin, including sodium or lithium heparin depending on the manufacturer. Lavender microtainers contain EDTA. Question 14. Which of the following specific layers of the skin contains blood vessels, nerves, hair follicles, and sweat glands? Option A epidermis. Option B dermis. Option C subcutaneous layer. Option D stratum corneum. The correct answer is option B, dermis. The dermis contains blood vessels, nerves, hair follicles, sweat glands, and connective tissue. The epidermis is the outer avascular layer of skin. Question 15. Which of the following white blood cells is responsible for releasing histamine and heparin during an inflammatory or allergic reaction? Option A neutrophil. Option B lymphocyte. Option C basophil. Option D monocyte. The correct answer is option C, basophil. Basophils release histamine and heparin during inflammatory and allergic responses. Neutrophils are primarily phagocytic cells involved in acute bacterial infection. Question 16. Which of the following types of fractures occurs when a bone breaks into multiple fragments or pieces? Option A, green stick. Option B, comminuted. Option C, compound. Option D, stress. The correct answer is option B, comminuted. A comminuted fracture is a break in which the bone is shattered into multiple fragments. A compound fracture refers to an open fracture that penetrates the skin. Question 17. Which of the following terms refers to the absolute legal right of a patient to make autonomous decisions regarding their own health care and medical treatment? Option A, beneficence. Option B, non-maleficence. Option C, justice. Option D, autonomy. The correct answer is option D, autonomy. Autonomy is the patient's right to make informed decisions about personal health care. Beneficence means acting in the patient's best interest, but it does not define decision-making authority. Question 18. A medical assistant is scheduling several patients who require the same diagnostic procedure at the beginning of each hour, allowing them to be seen in the order of their arrival. Which of the following scheduling methods does this describe? Option A, wave scheduling. Option B, cluster scheduling. Option C, double booking. Option D, time-specified scheduling. The correct answer is option A, wave scheduling. Wave scheduling books several patients at the start of a time block and sees them in arrival order. Cluster scheduling groups similar procedures together, but not necessarily at the top of each hour. Question 19. A medical assistant is performing a skin puncture for a blood glucose test. Which of the following steps should the assistant perform immediately after puncturing the skin? Option A, squeeze the finger forcefully to get a large drop of blood. Option B, wipe away the very first drop of blood with clean gauze. Option C, apply the first drop of blood directly to the test strip. Option D, wash the finger with soap and water again. The correct answer is option B, wipe away the very first drop of blood with clean gauze. The first drop from a skin puncture is usually wiped away because it may contain tissue fluid or contaminants. Excessive squeezing can hemolyze the specimen or dilute it with tissue fluid. Question 20. Which of the following steps must a medical assistant perform first when encountering a chemical spill in the laboratory? Option A, mop up the spill with paper towels and toss them in the regular trash. Option B, consult the safety data sheet, SDS, for specific cleanup and safety instructions. Option C, pour water over the chemical to dilute it quickly. Option D, evacuate the entire building immediately blank. The correct answer is option B, consult the safety data sheet, SDS, for specific cleanup and safety instructions. The safety data sheet should be consulted first because it provides chemical-specific hazards, PPE, and cleanup instructions. Diluting or wiping the spill without guidance can worsen exposure or reactions.